Well, hey there, everybody. Welcome back to our course on relational care. So we are in the fourth week. It's hard to believe it goes this quick, but so what I'm hoping to do today is just give some highlights about our topic for this, our particular topic for this week, and then try to wrap up the course into some bit of succinctness and perhaps some messaging that we can carry forward from the course. So this week we dive into the idea about true self and separate self or false self. And this is a really important topic for our conversation about relational care, and particularly the wisdom pattern of going from order to disorder to reorder. And so what we were able to have an opportunity to read and reflect on this week is in one, James Martin's book here, mostly on the life of Thomas Merton, who, as you will read or did read about, is a Trappist, was a Trappist monk, and very famous for many writings and his work in spirituality, and as many have said, he's probably one of the most influential spiritual teachers, at least in American history. Died in 1968, but his work on in lots of ways, but in particular, he's the one who really started talking about true self and what he called false self, or what we can also refer to as separate self, or the small self. And that is the reason I included that in our work, and actually giving 25% of the attention of this course towards this, because I think it's a really important part in our movement through the disorder into the reorder. Because as you have read about in the book and in the other Center for Action and Contemplations, Richard Rohr's reflections for that I had, we read that weekly reflections about true self, it is only when we can really understand that only part of who we are is who we think we are, particularly in the first part of life, where we have our identity being wrapped up in perhaps our achievements, like being really good at school and moving from high school to a good college, and then moving from college on to medical school, and then moving from medical school on to a residency, and so on and so forth. And that process is really important, and who we are as we move through that process is a really important part for our journey and our life journey. And so we put a lot of emphasis on that, things that we're really good about and that are very socially acceptable, like being a good student and getting good grades and becoming a doctor and serving humanity, and all really good and really, really important parts of who we are. And what Merton is saying, and what Martin is saying in the book too, is that that's just only part of who we are. So there's a journey that we're going through, and that if we can recognize that all of these accolades and these titles and these labels that are all so very socially acceptable is only a piece of who we are, but not forgetting what they are, and not forgetting who that part of us is. And that's, including that all in the whole, both this separate self piece that is really just the labels when we take ourselves too seriously, and then the true self of the person who we truly are. All of that is combined into one of who you are. And it is that process of moving, as some have really, I think appropriately described it, as moving from first half of life to second half of life experiences, and not saying that it's in a number of years perspective. It's just we move through this first half of life when we see that, feel like who we are, and the seriousness of who we are is the only person that we are, and that unfortunately that person that is just held together by labels and accolades and a very much of a control to say this is I want to hold on to this part of my identity, is all good and actually very necessary in a lot of ways for us to keep moving forward in what we're doing, but also at some point needs to fall away and needs to have us not be holding on so tightly to those labels and that particular person our identity is wrapped in, and then to move into this person who we truly are. That's when the liberation and the freedom and what I would say wholeness and well-being and wellness actually start to come alive in that. And one of the mistakes I think that a lot of people make when they read this is, and also goes with the cosmic egg that we read last week, but when you move from this my story to our story to the story, or when you move from this separate self to true self, it's easy for us to think dualistically and look at the not being true self when I'm not there yet as something that is bad, and then something over here that is good. Moving in this direction is where we need to be, but I'm not there yet, and feeling bad about that. That I think is easy to, in our binary mindset and rational thinking in that way, is to say I'm not there yet, and that is, one is good and one is bad. But hopefully you can come to some type of thought process that both are necessary. Both the separate self and the true self are necessary, and it's probably not possible to live always in the true self. I don't know if that's right or not, to even say that, but it seems like there are times when that separate self person needs to sort of step forward in certain situations, I guess. But I think the key is that we don't take that separate self, that part of us, too seriously. There are, parts of our lives where certainly it comes, when we have a job to do that, this is, this very structured, linear parts of our lives that seem to need our attention and perhaps our labels and our ego to be able to make it happen. And I don't mean ego in a bad way. Sometimes that gets a bad rap in all of this business too. It's a necessary part of who we are. It's part of the whole, and we can't just say, I don't have an ego anymore. I need to put that all aside, because I think there is a place for it. But the point of it is that I don't take that so seriously anymore. I know that's not who I truly am. There are times when I need to be in that mindset probably, but I know that's not where I need to rest and spend my time, most of my time. And so as you journey forward into this second half of life, that you live into this true self of who you really are, and also being, going with that is what is it that is yours to do, and so then you have this clearer idea about what your purpose is, and perhaps what your calling is, maybe a better way to say it. And so all of these pieces come together as all being important and all part of your life story and your journey. And so then how does this all relate? Actually, before I get into that, one of the points that I want to make about this in Martin's book, which I really I love, it's a quick read. He's such a great, if you ever want to read some really good stuff, just look up James Martin. He's a Jesuit priest, as you know from reading the book, but he's written some really great stuff. And I think it's funny at the beginning of this book, how he writes how he's not an academic and he's not a scholar. and so he seems like a little apologetic for that, but man, he has good writing, and he's written a ton of stuff. He's really popular for some of the stuff that he has some really great videos too, but especially his writing is fantastic. And it's funny how he seems to apologize for not being an academic, but he does just such great work. But anyway, so on page 57 of this book, I think it really wraps up of what he's talking about here and the reason for writing the book, and it gives a great, I think, succinct message about what he wanted to write about here. And he's talking about Merton and particularly, thinking about Thomas Merton and four particular qualities that these two men had. And the one is that they always tried to be honest. The second is that they were not afraid to admit their sinfulness, as he says, or their wrongness, their failures, their whatever inadequacies. Third is that they were open-hearted seekers, and that they had, I think what that means is that there was some genuineness to who they were, and they had some real intention, some genuine intentionality to move in a direction. And then fourth is that they tried to love. And then the next sentence he says here, the next start of this paragraph on 57 is, in other words, they were human, and that they mirror all of us. And I think that's the great part about the message of this book, is that for both men, the long process of self-understanding enabled them to grow in freedom and to become more authentically themselves. And then the great quote from Merton, of course, in New Seeds of Contemplation, where he says, "For me to be a saint means to be myself." And so this idea about separate self and true self is really a coming to some kind of okayness with who we are, living into the person of who we are, the goods and the bads, if we want to label them like that. Everything is included in the whole, and everything is important and included in that whole. And I think it's coming to this okayness with that person where we actually are living into our true self. Again, it's paradoxical. How many things have we talked about in the last 4 weeks that we use that language of being a paradox, but this is us becoming okay with everything about us, is what the things that aren't, which we don't like to perhaps admit or aren't maybe socially acceptable, is where we actually come to a fulfillment that things are good, things are okay, everything is necessary, and everything is included. So, that's the part here that I think is important from this book, from Martin's book, and then of course we've got the reflections from the CAC, the Center for Action and Contemplation, about this topic, and I think they're so well written, and again give us even more insight in a different way of saying it, because there's different authors in those reflections and different examples about what true self and separate self looks like. But one of the ones I particularly liked was when we bring it back to our conversation in this class, our overarching conversation about relational care, relationality, and particularly how that relates to the idea of compassion, is that one of them is talking about suffering as being a separateness. And this reminded me, as I was reading this, it reminds me about, the differences between what happiness and joy are, and the differences between what pain and suffering are as well, and that they're not the same. And that I think we use the language of suffering in a way that sometimes doesn't mean what we're talking about. We kind of overinflate it, and certainly all of us have experiences of illness and pain, but it is, whether that's physical or emotional or psychological, however, spiritual, however that looks, it seems to be the pain is part of our humanness, and it's the suffering that comes about when we have a difficult time accepting what our experiences are. And so I think this is where we can make a real impact related to our conversations on relationality and compassion. Because what we see, of course, in a clinical experience, a lot of times for most people, that's some sort of pain, right? Or illness. That's why they're there. But not everyone experiences it in the same way. And some people are suffering more than others. And that's for lots of other reasons. And so I think this is our opportunity to show compassion through this relational exchange. And of course, you don't, as a physician, have these conversations about true self and separate self. And the reason we're having those here is for us to gain a greater understanding about perhaps where the suffering is coming from, and that a lot of people have this, are challenged to let go. It includes all of us. And again, the reason for us doing the contemplative exercises that we're doing over these 4 weeks, but is to practice the letting go part. And so if whatever we're holding on to, whatever we're clinging to so tightly to maintain that control, to maintain that sense of certainty about the outcome, if we can, in some ways, let that go, at least partially let it go, that can go a long ways to help relieve our suffering. And I think for us as clinicians in that clinical environment, what does compassion look like? Well, you don't need to talk about relationality. I don't think you need to talk about, if you just live in your true self, then everything's going to be okay. Of course, that's, not the right approach. But what we're saying here in this course is what is, I feel like, important is you being able to have an exchange, a relational exchange with a patient, and that relational exchange, and hopefully that way of being, that you are open and available and putting yourself in a position for a patient to feel like there's an exchange happening, where there is some kind of vulnerability on both ends, where there's flow going back and forth between the two of you. That is a compassionate act and a compassionate posture in itself. And that is what is going to show this transfer that's going, and I think appropriately worded as love, that's flowing back and forth between the patient and the provider, or the patient and the colleague, or certainly any type of relationship that you have, that flow that goes back and forth. So all of the context in this course, if we can wrap this up about relational care, I think always seems to be steering us back to being able to put ourselves in this position so that there is this flow, this relationality, this relational exchange that's going back and forth. And how we get there is to let go of some of these things that we hold on to so tightly, like perhaps how we are perceived to think and act and feel as a physician, as in if we think that we have to be stoic, and that we always have to have the right answer, and that we always have to be this person that is maintaining a posture of being in control. If we can let our guard down there a little bit with those ideals that we hold so dearly to the healthcare professions, and show a little bit of vulnerability to our patients to be able to have an exchange, a relational exchange with them. I think that can help the patient to understand that they aren't alone, and that what they are experiencing is very much a humanness type experience, and that we all have those experiences. And you're playing your role as the provider, and they're playing their role as the patient, but you are both necessary and both needed and are both important in the whole of what you're doing, and for both of you. And so, bringing this back to one of the reasons why it seemed to be important to create a course on relational care, particularly in this overarching idea about compassion, is that going back from one of the first things we said in the course is that bring this back to a science perspective, that the data is very clear that physicians who score high on compassion scales have better overall well-being themselves and seem to have greater sense of joy in medicine themselves. And so why is that? Well, it's I think all of the things we talked about. I think it's a sense of letting go of these perceptions that seem to be getting in our way of having a relational exchange with people. But it's also, I think, a recognition that disorder and suffering is part of the story. It's part of our human experience. And that there'll be times when we feel like we're very much in control and it's a very orderly, and then something goes south and we lose control and we lose order. And hopefully, if we can remain there, not trying to let it to push the river too hard, where we're either trying to get through it too quickly, run away from it, and certainly not project it, our fears and about that experience onto other people, that we will eventually move into a reordered state, and that there will be some type of outcome that is better than what we had ever expected in the past. And so at some point, when you experience these challenges within your personal life and your professional life, that these skills that we've talked about, or these topics that we've talked about anyway in this course, and then the skills that we have been practicing about being contemplative and letting go, that those you'll be reminded of those perhaps, and be able to come to an idea about or some sort of okayness, that okay, I recognize the process, I'm in this. This is a pattern that keeps repeating in my life, and it's okay. It's part of my experience. But let's not try to move through this thing too quickly. Let's stay here and see if we can try to gain something from what I'm experiencing here in this disorder, and not take this out on other people, but also not try to run away, but just live with it in the moment, and see where this takes us. I think that's a really important part of our own personal well-being, and that's why it's here. And one of the obviously big pieces to this is our ability to be relational with others, of course in our personal lives, but in our professional lives too. And that seems to be a key piece to all of this wisdom pattern, is that relationality story. So that's the reason for all of this, and hopefully that makes sense as you finish up this course, and that how all of these pieces fit together. So with that, I hope this was meaningful for you. In some ways, I feel like I hope that you can take some of this material with you, and that you'll have time to think about it and let it digest a little bit in the coming weeks and months and years even. And I would encourage you to continue to recognize these patterns, this wisdom pattern we talked about, of order, disorder, and reorder, and continuing to recognize the importance and to practice the importance of some type of contemplative exercises as well. So as you go through your professional career, and then hopefully that maintains a sense of joy within your practice, of the realization that and the experiences of having these relationships with the people that you work with, that is really the bedrock of what we're trying to do in our humanness. So thank you again for all your great work throughout the last 4 weeks. And I would love to stay in touch. If you have any questions or want to just reach out for anything, please feel free to do so. I wish you all the best in your future, in your medical career, and hope we can cross paths again soon. Thanks.